From Ebola.
La maladie de Ebola.
Mwangi Nondi says he developed a fever after caring for his brother who died from Ebola. But Nondi is better now after receiving the Ebola vaccine. Doctors in Congo say they have not been able to vaccinate everyone who has been exposed to the virus, and they're still finding new cases that are not linked to cases they have already confirmed. This means the virus is still actively spreading, and health workers still don't have an accurate picture of what's going on. Congo's vaccination campaign is targeting more than 1,000 health workers, along with those who have had contact with people who developed the virus. They use a ring approach, where health workers identify newly diagnosed Ebola patients and then set out locating people they've been in contact with, from family and friends to neighbors and work colleagues. The vaccine they're using was developed during the Ebola outbreak in West Africa. It's not licensed yet, but it has proven to be safe and effective.
What it does, it teaches the immune system to recognize those Ebola proteins on the surface of this modified virus, and in doing so, create a protective response against that.
Because the vaccine can only be tested when there's an Ebola outbreak, there are many unknowns.
What we're trying to do now is to establish how effective is this vaccine. Do you need 1 dose or 2 doses to be protective? And once you've been injected or vaccinated with this, how long does that protection last for as well?
Containing the virus is difficult because many areas impacted by the outbreak are close to heavily used waterways. It started in rural Bigoro, then moved to Mbandaka, a busy port city along the Congo River. People use the river to bring produce to the country's capital, Kinshasa. Health workers say keeping Ebola out of heavily populated areas is critical to containing this outbreak. Carol Pearson, VOA News, Washington.